Okay, good morning, everyone, and good evening, some of you. I'll start the session within next 1 minute. Just give me some time. Thank you. Okay, let's get started now without wasting the time. So, welcome back, everyone. This is going to be the class second, part two, you can say, for the mental health nursing. As most of you know, we just start the mental health nursing today. I already post the first video on the YouTube, referring chapter number 68 for Saunders 9th edition. And I already mentioned everything there about that chapter, what do you need to know. And then in today's class, we're going to talk about the chapter number 69. Okay. So I'm just going to share like a blank screen maybe in front of me, which I might need to use it sometime while we are discussing some topics today. But as most of you know, I already make this announcement ahead of time that bring your Saunders book today into the class so we can read this information together, right? So basically, the purpose of class today is what? The purpose of the class today is not just learning about the mental health disorders, but also at the same time, I think most of you wants to know how to read the sounders at the same time, right? So this is my also goal in this class today, like also help you to understand how to read the sounders at the same time as well. Now, I'm just going to share the screen quickly. And if you cannot see the screen, please let me know. In the chat box, you can always type your message in there. I highly recommend if you're watching on YouTube, try your best to use the chat box in YouTube maybe because it's more easy for me to access the chat box on YouTube on my other device. But sometime if I miss to see your message, I apologize. I'll look after a little bit later before the end of the presentation today, and we can discuss your all doubts together, okay? Right now, everyone is on mute, just so you know. So right now, nobody can participate into the mic, but I will unmute it for you a little bit later on today. So you will participate again into the class today as well to ask me the questions and doubts if you have. Primarily, I'm going to use the language English only today, but not very complicated. Very simple English language I will use it, which everyone can understand, I think easily here. Um, One person is on my screen right now. I can see someone is playing on my screen right now. I think the person name is Sumandeep. You're trying to scrolling on my screen. I can see. Try your best, everyone, not to use marker, whiteboard, something on my screen because as most of you know, I'm not a technology person, okay? But I'm trying my best to bring up these sessions today whenever we can study together because our main goal is to pass the NCLEX or either NORCET, or it depends you're using this information for which nursing exam, okay? So try your best to participate together along with me into the chat box. Now, some of you asking me, what page number in the Saunders book? If the other students already know what page number of chapter number 69, please type it for me because I also have a different edition with me at the same time. So I have if someone is looking for Canadian edition, I have Canadian edition right now with me right at this point. But if someone has a 9th edition sounder, please pull it up. It's exactly same, but the page numbers are different. So that's why I cannot tell you the page number maybe at the same time. Okay. But if you cannot find ACEs, let me know so I can figure out what page number is that for you. Okay. So this is chapter number 69, mental health disorder. This is what I'm going to discuss today. Chapter 69, mental health disorder. I hope everyone pulled this page already and I can begin the class right now. Okay. So now in mental health disorder, before you read any information in here, I really want to let you guys all know how to read diseases, how to read disorders, diagnosis for your NCLEX exam or for your NORCET exam or any other nursing competitive exam which you're writing down. But mainly I would say for NCLEX exam today, because this is where we're mainly going to focus on for sure at the same time. But if any other student joining for NORCET or any other, it's exactly almost same style, but a little bit more information you need on the top of it. So you can connect with me later on WhatsApp also if you do have a doubt for your other nursing examinations too. Okay. But mainly for NCLEX exam, NCLEX PN, NCLEX RN, same, REX PN, exactly same what I'm going to talk about in this one. Okay. So the first thing, as I said, everyone, I really want to say how to read the book. Okay. So how to read the diagnosis information. This is where we're going to do my first part of the lecture today. And after we see how to read the diagnosis, then after that, we're going to begin with the next topics, in this chapter, the chapter which we're going to refer right after discussing the first part of the video today. Okay. So the first part of the video, as I said, how to read the disease information. Now, everyone, if you can make some notes, that will be great on it because I did not write it down on my screen, this one. I'm just going to talk about it. So if you want to maybe either write it down, make some notes, or maybe watch this video later on, which will be helpful for you. So the first thing, whenever you're reading any mental health or any medical condition, I would say, not just the mental health, any medical condition from any system, you're using the Saunders book. When you read that information, the very first thing you need to know the meaning of that particular diagnosis, the meaning. Okay. Now, when I say meaning, that does not mean that you need to know exact definition. No. Not exact definition. Why? Because NCLEX is not going to ask you what is PTSD, right? What is COPD? What is diabetes mellitus, right? So they're not asking you exact definition in the exam, but they really wants to know the meaning. Like if you really understand the concept, right? So first thing is understand the meaning. That doesn't mean you understand into two words, into one word, into one line, one different sentence, two sentences, three sentences. That depends the way of your learning at the same time. So you will see with me how I'm reading as well. So you will also see with me as a part of example after this slide. Now, the second thing, when you read about the diagnosis condition, you really need to know about the sign and symptom of that problem particularly, right? Now, I always says you only know the sign and symptom if you know what is exactly happening into that problem, right? If you don't know what is exactly happening into that problem, you don't know what the sign and symptom look like. In my experience so far, if somebody asks me, do I remember all the Saunders book? No, I don't even as well. Why? Because I use this method, the one I'm going to give you guys today. I just, try to link everything between each other, like why the symptom tachycardia is a part of this diagnosis, why it says dyspnea is a part of this diagnosis, why the patient is restless is like a silent symptom in this diagnosis, why it says irritability here. I always ask my brain why, right? So when you know the why, it's easy job, to remember something for a long time. Then you do not even need to make the notes a lot. Then you do not even need to cram a lot, believe me as well, right? So I highly recommend when you're reading today, sign and symptom, try to understand with me, why is it there? Why this symptom isn't there? You really need to understand the things behind, not just look into the book and remember it, write it down, revise it. No, because none of the competitive exams, I can tell you, they are not posting exact copy paste sign and symptom list or side effects of medication or nursing intervention exactly from the book. No, but they will rephrase the word for you. So which means the books are still helpful in the exams, but they will rephrase the word for you. So if you know what is the actual meaning of look like and if they rephrase the word for you in a different way, then you automatically know, okay, why is this is the symptom as a part of my right answer, right? So number one, as I said, know the meaning of the problem, just meaning. And remember everyone, that doesn't mean that the meaning you have to understand in English language. If you are international graduate nurse, you know maybe a different tongue language, right? Or different your local language. You can also understand the meaning into your own language as well at the same time, right? Just understand the meaning only. And after you understand the meaning, then you link the sign and symptom with that. And once you know the sign and symptom of that particular problem, number three is once you know the sign and symptom is, you need to know the nursing interventions, right? Nursing interventions, NS, right? Or maybe discharge teaching, right? DT. I'm just going to write down the short words maybe in here. Nursing interventions or discharge teaching for that particular diagnosis. Now, of course, lot of diagnosis, you also read some extra information in there, do some lab test as well. Any extra thing you need to know that about that particular diagnosis in there, so those are the little bit extra information on the top of it. If the Saunders give you that as a part of red color highlighted flagged something with a pyramid, I recommend yes to do it. But if that's something not really highlighted much in there, then just skim and scan a little bit. Okay, but these are three important ones which you must need to know, not just for mental health, everyone, for everything. Any diagnosis you're reading for this exam, you need to know meaning, sign and symptom, nursing interventions, and discharge teaching, right? So this is how you should read the content. The first part of the content, I'm giving you a base today. The second part of content, which is on medications, everyone, I'll teach you on Monday. I'm planning to do the next lecture on Sunday after today's class. I'm not available tomorrow, unfortunately. I wish I could, but next session I will be on Sunday. And then on Monday, we'll be on the medications as well. So when we do the next lecture, after that on the medication on Monday, I will show you exactly how to read the meds also, right? Because I never crammed the meds in my life so far. Once I know this type of method works really well, right? So maybe it works with you also, right? If it is, let's take it, right? But if it does not, maybe you do have a more stronger knowledge already, then maybe you don't need much that information in there, okay? So this is the method I'm going to apply also today in today's class as well. I thought to tell you this method first before I begin anything in here. Okay. Now, again, everyone, this is just the reference book. I'm using it, which a lot of you know, I recommend Saunders book a lot for this examination. Now, this chapter, the one I'm talking about, this is from your ninth edition, and these are the common topics which I think they're very hot topics for the examination, which everybody needs to know. And apart from that, if you find more topic, which I can see more topics also in the same chapter also, well, you read it if you have enough time for your exam, right? But if you don't have much time left for your exam, then maybe if you're writing, in a few days, maybe 2 weeks, 1 month or so, maybe you only want to read the hot topics in there, right? But if you have a lot of time still to write down your test, it's a good idea to read as much as you can, as much as you can. Okay, so it's not something, do only these 5, 6 topics, you're good to go, right? I highly recommend if you have a lot of time, right? Try your best to read the other topics as well, also from the book. Now, the best thing I can say is when you read the other topics from the book, apart from these topics, which I'm going to discuss today, if you do not understand those topics also, let me know in the WhatsApp. Okay, let me know in the WhatsApp, send me a message, maybe a phone call if it's very urgent, or send me a message and tell me in that message which topic you still finding difficult for yourself to understand from the book. So I can simplify it for you and I can explain it to you. Okay. So now let's get started without wasting the time. Hope everyone has the book. So I'm just going to have the book with me. Book sharing, I'm not going to do it on the slide, which I already mentioned in the class announcement before. I hope everyone know that. And the students who is watching on YouTube right now, I hope you have the book with you at the same time as well. If not, maybe you can just listen me at the same time. And if you find any difficulty in understanding, just let me know. Okay. So the first topic, which I'm going to see in here, let's see. Okay. Is everyone able to see the screen? Because I think YouTube students, they are not able to see the screen. I just want to make sure. Someone asked me, ma'am, this lecture available on YouTube if I missed. Yes, Naprit, it will be on YouTube also. Everyone can see the screen, right? Okay, perfect. Just want to make sure this one, right? Now I know the students in US or in Canada, some part of Canada or states, maybe it's too late for you to stay awake. This lecture might gonna take about 1 hour to 1.5 an hour today to discuss about it in detail. And if you find very, very sleepy, you can maybe go to bed and you can watch my this class later on also when you wake up in the morning also, okay? So if everyone can see the screen and you already pulled the book, let's maybe get started with the first topic, which I have here is the generalized anxiety disorder, right? Now, in the book, you will see the first topic they give you anxiety. Let's skip that. If you have time, then read it. But if you don't have much time, maybe you want to just do the important topic, as I said. The second topic, which I want to discuss right now, which is generalized anxiety disorder. I would say this is okay topic, but which I feel like still everybody needs to know about this topic as well, right? So let's see how I'm gonna read this information, right? And I will only skim and scan and find that information in there, the one which I think is important for exam for everyone and they needs to know, okay? So maybe if you want to highlight it, use pen, pencil, something, you can do that as well. Now, one thing I forget to say, everyone, before I start reading this topic right now, sorry for that. I think some of you know already, but some of you who do not know, you're joining my class very first time today. Just so you know, sometimes if I got a little bit, I should not, it's not like an emergency, but yeah, my baby is sleeping in my next room right now. But just in case if my baby gets awake, I'll take a break for 5 minutes only. Okay. And then for 5 minutes, I'll just quickly turn off the camera and come back again as well. So maybe don't feel like where I am right now, at that time, like, where is the ma'am? I cannot see you on the screen. I cannot hear you as well. So if I just go to the next room only for 5 minutes, I really, really apologize for that. Okay. But I will come back and I'll try to come back as soon as I can. Okay. So this is one thing I want to highlight it for sure because it's like 11:20 in my location right now in the nighttime. So everyone is sleeping. But yeah, sometime I need to tell this to my students just in case. Now, back to generalized anxiety disorder. So the first line, if you see in there, this is actually they tell you the meaning of this problem, right? So when you're reading it, you should read it like this, like GAD, generalized anxiety disorder, is an unrealistic anxiety about everyday worries. Okay. Well, you already know the meaning now. If you still need to read the next line, you can. But if you already understand that this is like anxiety, they are talking about everyday life, everyday anxiety, what you usually get something in the life and something unreal, unrealistic, not something, this is how you can see the language. So those students who find difficult to understand sometimes the language of the books, this is how you can understand with me. So once you know, like, the simple meaning of the GAD, right? They're not asking you how it persists, when does it persist, when does it come in the real test. But if you have time, you can read the next line as well. But if you already understand the one single line, you're good to go. Like, this is like everyday worries, I would say one line. So if you want to write down with the pen next to it, is equal to everyday worry. That's it, right? So this is how you should just keep your brain like to the point, right? Now, once you know everyday worry, then definitely you look at the sign and symptom list, which is the part two, the one I just mentioned. Know the meaning, know the sign and symptom. Now, the sign and symptom I can see here, they give you in the form of assessment. Basically, when you have a patient on the floor, what sign and symptom you're going to assess, and how would you know there's someone diagnosed with this problem? So this is kind of list what they give it to you. And as I said, list is always not like limited until here. It could be more than this also, right? A lot of research is happening every day. So that's why do not cram the list, just understand it, right? So it says here restless, inability to relax, right? So you just know that, okay, if I got a stress every day, I will be restless too. I will be like not able to relax as well. And then second option is second point they give it to you, episodes of trembling and shakiness. This is more happen, I think, in those cases when you get worried a lot, right? You feel like shaking more, like it's more like a physical symptom comes to you now, right? You feel shaky, you feel like it's more like a body movements, abnormal body movements, trembling, what they give it to you, right? And then after that, they said chronic muscular tension, right? This one developed with the time, not something right away, right? That's why they use the word chronic. So definitely this can be affected to your muscles also if it is there since very long time, very long period you are just having this problem. Now, dizziness, right? I would say dizziness can happen more, when it start affecting your vital signs at the same time, especially your pulse and the blood pressure. So if it start affecting that, the person can might feel dizzy also when they stress a lot in their everyday life. And definitely you're not able to concentrate, right? And you're going to be more tired, you cannot sleep much enough, more sleepy problems, right? And inability to recognize the connection between anxiety and physical symptoms. So sometimes you don't know if this is something really an anxiety issue, like more than a stress in yourself, or is it something bothering to your body right now? Like, do you really have that kind of pain in your body where you feel, or is it more like the mentally you're getting upset is in here? So sometimes patient cannot, differentiate those symptoms as well, right? Now, the client is focused on the physical discomfort. So here you will see the client or the patient. Usually we use the word client just so you guys know, because we always maintain the dignity of the patients always in here. So we usually call them client, right? So the client is basically more on focusing on physical discomfort because they're physically not doing well. Like, as I said, not sleeping enough, restless, their body is really tired. Pain could be as well, which is not in says in here, but it can be, right? So this is how you should think the overall and make a clinical picture in your brain. Okay, this is how my GAD patient can look like somehow, right? Now, once you know the GAD patient, how do they look like, right? Then you see after that the nursing interventions, right? See in the book, they also give you about the panic attack at the same time, right? You only read it if you need it, right? As I said, extra information can be given a lot for sure with every single diagnose. You only read if you want to read, you have enough time for that. But if you don't have enough time for your preparation, once you know meaning, once you know symptom, go to the nursing interventions right away because you can still handle a lot of questions in the NCLEX like that. Not just the questions, also it will help you practically once you pass the NCLEX as well in this way. So once you have a patient like this, you check the symptoms. The next thing I will see the nursing intervention. What I can do as a nurse with this patient. So definitely remain with the client and then attend the physical symptoms. So whichever symptom is in there, you make sure you do attend it as a nurse. Assess the client to identify the thoughts that arouse the anxiety and identify the basis for these thoughts, right? So this is like you helping your patient. Once your patient gets stable a little bit, your patient is okay to talk to you, and you try to explore with the patient, what do you think, what it aggravates basically? How do you identify with them? Like sit with them, talk with them, do some broad open ending conversation with the client. See if they want to tell you something, what's bothering them, right? And what increase anxiety for them. And then assist the client to change the unrealistic thoughts to the more realistic thoughts. Something what is more unreal bothering them, you try to help them to come with the real thoughts. So for example, let's say if I have an unrealistic thought right now, for example, I'm just thinking about, okay, next to next weekend, I have to go and do some shopping. Maybe I have to spend my whole day in there in the shopping mall. I have this kind of list, 10 plus items, right? So that is bothering me maybe right now. And it's too much, not just a little. Let's say it's too much and it creates the physical symptoms on myself as well, right? So this is something unrealistic for me because how do I know what's going to happen after 2 weeks with me in there, right? So try your best, help the patient with the same way. Think about something realistic. What can be possible? What can be achievable? What they can do at something. So similarly, so let's say if I'm a patient still in this scenario, and you are a nurse with me right now, so you should come to me and talk to me more in that way, like, okay, what about if we try to look our plan for today? How's your day going so far? What are you planning to do this evening? Do you have something in your mind? Like, are you like going to see your family in the evening today? Is your family coming over to see you? Do you have something, a special request for the dinner as well? So something which you think as per the client age or interest, the way they wants to be involved with you, you try to make something realistic plan with them, right? So this is one thing I want to talk about in here as a part of small example. And then once you know this thing, then they said use cognitive restructuring to replace the distorted thinking, right? Sometime the patient thinking just get distorted, you know like sometimes you think about go to, like, again, same example. If I think about going to shopping mall, then I think about to do my class this evening, then I also think about some phone calls at the same time. So it's too much, distortion here and there. Maybe I'm thinking about how to do some household chores at the same time. Oh, I also need to drive today as well. So a lot of stuff may be on the brain. And similarly for your patient also, maybe it's so much disorganized thinking, too much will be in there, right? Which is like distorting them. It's like more segregated. So you try your best to put the things together, right, for them, and make a nice constructive plan for them, which helping to increase their cognitive function basically at the end of the day, right? So this is how you help the patient in there. And the last one, they said administer the anti-anxiety medications if prescribed, right? So see, this is how you read this topic once when you read the first time reading. Now, the next game on the same topic, once you read the topic, right, you really need to ask yourself when you're prepping for this exam, you ask yourself, what comes first, right? What is the best I can do in this situation, right? So those answers, you look into the nursing interventions, right? But also make sure your assessment, sign and symptom, everything is clear in your brain. You're not cramming anything when you're revising second or third time as well, right? So when I say the intervention, I ask my brain, okay, what I'm going to do first with this patient? I will just ask myself, okay, what about if my patient is in acute stage right now, having the anxiety, more than anxiety, which is panic attack, right? Then what I'm going to do first? Because in that case, maybe it's more like a breathing issue at the same time, right? Then maybe I want to think about around the breathing also, which is not mentioned in the book. And after that, you look for the oxygen something, then you see you want to stay with the client. Now maybe you want to call the doctor for help. Next step, maybe you want to get some medication on the order on your hand. So this is how you think critically put yourself as a nurse in that situation. What are you going to do as a nurse, even if the question is not in front of us, you know? So this is how you basically read this topic, and then you ask yourself, what are you going to do in there? Like, imagine yourself as a nurse into that situation. Some of you maybe like mental health, some of you maybe don't like mental health, but still at the end of the day, you need to put yourself in that scenario so you can make some imagination. And believe me, imagination you will never forget in the exam. You can easily recall a little bit something in there about the same topic, right? So this is how I read a basic information quickly. You know, as a student, if I'm a student just like you guys, I will read it like this. And then after that, I will ask myself, do I need to make some notes? Right? So I will only make some note as a student after reading two, three, four times. You know, two, three, four times after I read it, if I still feel like I'm forgetting something, I will only make a small note for that. Right? Not everything, because I don't want to print another book before my exam. Right? And then if you already remember something, maybe you don't want to write down anything in there because you already remember maybe more than 90% about this topic, right? So this is how you should read about the GAD. Just a first example, the one we discussed today about how to read this topic in Saunders' book. I hope everyone is learning so far how to read it, how to utilize this information. Um, any questions so far until here? You can use your chat boxes, please. Or if you do understand, maybe you want to just tell me yes, no, understand, not understand, something, whatever you guys want to say. That will help me to understand if you guys are learning or not. Because the purpose is not just to deliver the class today. It's something I really want to make sure you guys know what to do and how to do, right? So I can see three, four responses so far. Yes, Navjot, I'm in the Edmonton area. Yeah, thanks so much. Okay, seems like mostly everybody say it's understood, right? Okay, YouTube students understood. They said page number. So YouTube students who just joined the class right now, I'm on the chapter number 69 in Saunders' book. And the first topic I read, generalized anxiety disorder. Okay. If you just jump in the class right now, maybe you missed to listen my previous messages. This video will be record as a part of recorded on YouTube later on. So you can watch this video as many as times you guys want. Okay. Now, without wasting the time, if everybody understand, let's go to PTSD, right? And imagine yourself as a nurse is in there and think about a patient also as a part of a clinical scenario in your brain, right? Why I'm saying that? So you can remember that information for a long time. You don't have to read then PTSD again and again, right? Now, PTSD is what? Post-traumatic stress disorder, right? I would say very important topic. Very, very, very important. So everybody needs to know about this topic for sure. And here I can see the first line they give you as a description. That means it's like a meaning they want to highlight it for you, right? So as I said, understand two, three words as a part of meaning, right? So they said, after experiencing a psychologically traumatic event, individual is prone to re-experiencing the event, maybe recurrent dreams or flashbacks, right? Hold on. What do you understand from here? Ask yourself, maybe in your local language, in your English language, whichever language you understand. So for me, I will ask my brain, like, okay, they're talking about after traumatic event. Somebody seems like experiencing, flashbacks about that event, or maybe dreams about that event, like a bad dreams or more frequent dreams about it, right? So this is how I tell my brain the whole, like overall meaning about this. What is PTSD look like, right? Now, after that, I can see they give you some example of stressors, like what could be, the reasons which further leads the PTSD basically. But if you have time, you can read that. If you don't have time, you don't have to go into, as I said. So for example, if I have a time right now, imagine I'm writing exam after 6 months NCLEX, I will be reading like this. Natural disaster can lead PTSD, or terrorist attack can also do that. Accidents, rape, crime, sexual, physical abuse, emotional abuse. So this is how I would think about it, like how to read this information. And as I said, you don't have to read word to word in there as long as you understand the meaning about it. Now, once you know that, assessment is very, very important, everyone. Do not skip it for this exam. So mark it as a star or whatever you want to put it in front of it. So assessment, I can see when someone has a PTSD, they might feel numbness, right? Emotional numbness or detach from society. So you don't know what's going on around you. You don't feel like to participate in there. You don't feel like to go into that situation, you just feel like you're lost maybe, because it's bothering you to your brain right now. You kind of depressed, maybe anxiety, very anxious, sleeping problem, some bad dreams, nightmares, flashbacks, very important. Flashback of the events you keep thinking about, maybe you see them again and again in front of you, but they're not actually in there. Excuse me. Hypervigilance, right? Those students who don't know sometime, as I said, what could be the meaning of hypervigilance? You split the word. Hyper, high, vigilance, sounds like VG, violent, something like that, right? It will take you there, what the patient behavior look like in this case. And then guilt about surviving the event, like how you went through that event, you feel guilt about it, how you went through that situation, why does it happen to you, this is how patient might feel like about it. And then poorly concentrate, avoiding of those activities that triggering the movement. So that's it. That's how you think about the assessment, right? See, do we need to cram something? No, because you know the meaning, and your sign and symptoms, everything is linked to that because you know the meaning now, right? Now, once you know this, then you look at the interventions now. What do you do as a nurse in that case? If you're standing in front of someone who has a PTSD, right? Something, as I said, in triangle, red in colors is always important. Box is always important. I always recommend to do them for these tests, right? I can see now nursing interventions there in the form of the box right now. So let's read the box first. The box says, be a non-judgmental nurse at that time. Be supportive. I think this is a universal point. Now, when I say universal, what does it mean? Universal means which can apply with any patient, not just PTSD, right? Because you want to be non-judgmental everywhere. You want to support every patient in this world, right? So something which is universal, guys, it's always the right answer. So let's say if this question come as a SATA in your exam, you definitely pick the answer. Doesn't matter what is the diagnosis of the patient look like, right? And then second says, assure the client that his or her feelings and behaviors are normal reaction. Okay, basically you tell the patient kind, okay, I can see Mr. X. I know this is how you feel right now, but this is normal as a part of your diagnosis, right? So this is how you say. And then the third one is assist the client to recognize the association between his or her feelings and behavior and the trauma experience. So basically, you try to help your, client to figure out, um, what could be the relationship of the one they feel right now and the one they experienced before, what could be the relationship of that? Is it something you still feel the same? Is it something your symptoms getting worse, your feelings are getting worse after that tragic event? Or do you feel better now, like, or it was a worst before, right? So this is your job being as a nurse, to stay with the client and do this type of conversation with them and collect the history from there so you can help further. And then it says assist the client to develop adaptive coping mechanism and to use relaxation techniques. I would say again, this is universal point. Majority of the clients in the world, I would say majority of the mental health, they really need to have coping mechanisms, and majority of them they need relaxation techniques as well to get relaxed, to calm down their brain at the same time. Support groups, you can use it if needed. encourage the use of support groups. Now, most of the students, I think, who are maybe watching this lecture right now, I would say, especially from India, Pakistan, or other Asian countries, I think majority of them, we don't have much support groups in there. It's more like a hospital setups, right? So support groups is basically what? I want to give you an idea. Support groups is basically, it's like a community resource. You send the person wherever you think the person required that more information or help in there. So, for example, let's say with a PTSD as a patient, if I'm a patient in this case as a PTSD, and I get more stressed out, I start smoking cigarette, whatever, right? Which support group you want me to connect with? Definitely, two different support groups could be a good idea. The first one, maybe you want to look for that support group where I can actually quit the smoking if I can, right? Because that's affecting maybe my health. And then maybe second support group you want to find out at the same time where I can reduce my anxiety and I can be more involved as a part of everyday routine and something which I can recall, from my previous days, which makes me disturbed from the flashbacks. So that support group, maybe you want to link with a community where more participants are there, but they have the similar background before, but now they're doing better. They are doing some jobs in that community. Maybe they are doing some activity, recreational. It could be anything. And you want to send me as a patient in there so I can go and participate in there. I can be involved with them, make myself busy, make my life busy, make myself much better at the end of the day. So I don't feel like to go back to that flashbacks, right? But support groups could be any type of group, as I said, what your patient needs based upon the diagnose, the symptom, right? But this is example what I use for this particular diagnosis at this point. What could the support group look like for this particular patient? Now, the next one we have is facilitate a progressive review of the trauma experience. You always check, ongoing assessments, do some review. Any progression in that experience, the one you had it before in your symptom, or your symptom reduce, as I said, or decrease, or is it still same? Tracking, do some tracking as a documentation, I would say, better idea. Then it says encourage the client to establish and re-establish um, relationship. Sometimes with the PTSD, it's so hard to make a connection with the another person, right? So you help the patient, try to figure out what's stopping them, right? What could be the barrier, how you can help them, right? How the person can rethink about their behavior again and forget about the past stuff, and now they can make that relationship, right? So maybe they want to stop one relationship and go to another, right? Or maybe they want to reconnect with the same one. So that depends upon client to client. And then after that, it says, inform the client that hypnotherapy or systemic desensitization may be recommended as a form of treatment. Now, a lot of students here, what I know, 99%, I'm pretty sure most of you, when you read this line, most of you either Google it or either look at the what therapy is that, right? What is the desensitization and systematic and whatever, right? I would say don't do that because it's already sounds to you, it's like a therapy, whatever you want to give it. It's like a treatment, whatever you want to give it to the patient. Because they already said it's a form of treatment. So think as a part of treatment, which could be helpful for your patient. Now, why not to Google it? Why not to go too much into in this one? Because in your exams, they're not asking you, okay, question number one, what is hypnotherapy? ABCD. Do you think they're asking you that way? No, right? Then why would you waste your time into this? If it's something which you want to make easier for yourself, do this way study, right? It will help you a lot. But yeah, if a lot of students, in this world, they're more curious. They want to know more meanings behind it. If you are, you can know the meaning for sure. But let me tell you, when you're studying for competitive exams, you try your best to be limited, not collecting library in your brain as much as you can, because it's so hard to recall at the end of the day when you go to the real test. So try your best, make some easy for yourself, for your brain, because you only have one brain, right? And you only want to put the limited information in there, I guess. But yeah, still someone is interested. This is how you can check the information. Now, that's about the intervention. And there is something red in color. I can still see in here. The red in color information is the clients dealing with the cancer may develop the PTSD, and cancer-related PTSD can occur anytime during or after the treatment. The symptom of PTSD are similar to those of post-traumatic stress. Okay, the symptoms of PTS are similar to those of PTSD, but they are generally not as severe. This is just something not a diagnosed as a disorder yet, but still they do have the same post-traumatic stress from some reason. Maybe they give you an example here as a cancer here, like cancer patients can have this kind of issue because they are having a flashback thoughts, the previous thing again and again. Um, I would say just skim and scan, not very important. I can see this line because I don't see much information which can come into your exam from this line, but still a little bit skim and scan is a good idea because you never know when something red flag will come back, right? So once you know this way, the meaning of this line, just skip it, skim and scan, and go to next, okay? Now I can see a lot of next information in here too. Let's see. No, this is actually the next topic. Okay, that's all about the PTSD. I can see now in my book, right? Now, any question, anyone in PTSD? You guys understand this topic or not? Feel free to use again chat boxes, please. Zoom, YouTube, wherever you are watching me right now at this time, middle of the night, we are learning, right? Understood, you do not understood, let me know so I can move on to the next topic right away. I can see one person is requesting, ma'am, if possible, Hindi language as much as understand. Yeah, I would say, Sonampreet, the thing is, like I can try to deliver the lecture in Hindi also, but the first thing is most of the students here, they will not understand. The second thing, I highly recommend everyone. Even I'm also from India originally too. But when you're prepping for these exams, everyone, try your best, understand in English language everything. And this is our main purpose today. If I'm explaining you everything in Hindi or a different language, then later on you go back to Saunders' book, I'm pretty sure you will again not understand maybe some information in there. But if I go in the simple, easy language with you right now in the English language, you will understand more, I guess, because at the end of the day you're still writing exam in English language, everyone, so you really need to know, right? So try your best in that method if you can. But again, if you want to know something specific in the different tongue languages which I know, maybe WhatsApp me later so I can explain it to you. Okay. Okay, perfect. Seems like everybody understand. I can see understood. YouTube students, see, are you still there? I don't see much messages right now on YouTube, but let's go to the next topic in the meantime. Everybody's typing maybe. So the next topic I can see, OCD, right? OCD, phobia, read if you have time. If you have no time, not read it. Or as I said, some topics are important, some are not important. So you only read which you think you want to read it. Now, OCD patient, yeah, this is very important topic, I would say. OCD, especially nursing interventions. You really want to know this. Now, what is OCD? Obsessive compulsive disorder, right? Now, before even I read this information here, because it sounds like too much into the book, if you already know the meaning, you should just know the meaning, right? But if you don't know, then we can read it from the book later. But let's see, what is OCD? In my understanding, obsession. Obsession mean like a thought, a come to your brain, right? Compulsion. Compulsion means you want to do it, make it happen, right? So if I have an obsession thought and I want to make it happen right away, right? And this is like on repetitive, like this thing, not just the one or twice in your life. This is something I have a behavior on the repetition. again and again, then definitely it can be diagnosed later as the OCD as well, right? Because disorder, you really want to diagnose someone after you see the repetition of those symptoms, right? Now, once you know the meaning like this, if you understand, you're good to go. Then you only need to read the nursing interventions here. But I can see some, yeah, some information is missing here actually, which is not even in here right now. Maybe I'll show you guys from my mental health slides. Just give me 1 second, okay? Um, Let me pull my notes. I'm just going to stop sharing the screen for a minute so I can take you to my mental health notes right now from my other classes. Some information is missing in this book right now, which I just noticed. And you really need to know that too. So let me take you to that screen right now. If you want to take a screenshot of this page, maybe now or later, you can. But let me take you to the OCD, that information which I think you need to know, right? Let's see here. I'm just gonna do screen sharing again right now. Okay. This one, everyone. I hope you can see my screen back again, right? This information is something you need to know apart from what's they give you in the book, right? So once you know the meaning, now you need to know some common symptoms of the OCD, right? Again, you can take a screenshot or write it down, whichever works easy for you. Now, these are the common OCDs also I can see at the same time as well. The first one I can see here is the fear of contamination or contaminating others. So, when someone has the OCD, right? Sometimes they don't want to maybe shake hand with someone, right? Or they don't want to touch you, right? Because they're thinking if I touch you or shake the hand right now, I will get some germs from you, right? So this is first one of the common example of the OCD, right? And or you can say a symptom which you want to look into there. Now, the second one, what I know is the most of the OCD clients, why are they doing that compulsion behavior? Because they have a fear in their mind that they're going to lose the control if they don't do it. So for example, let's say right now, if I have like 3 books in front of me and I have an obsession come to my brain, go to page number 27 of this book, right? So if I don't go to page number 27 of that, maybe I'm going to lose control in my brain. I will be like, no, I need to. That's why I'm doing compulsive behavior of that again and again, looking into the same page, same number, which I already looked 5 minutes before, right? So this is also find very common in the OCD patients. And then the next one is fear of losing possessions or the items. Sometimes you feel like, oh, did I lose something? Let me check my pocket again. Is it still there or not? Right? When you go out of from your house, you check your pockets. Did I get my house key with me or is it still there? Is it in my purse? Did I put in my car that thing or not? So you're checking again and again. That could be a part of OCD as well. And then desperately avoiding triggering situations, right? So sometimes you want to avoid something before it get happened. It's just in your brain as a OCD client. So common example is cleaning related. So they clean a lot, right? So they will be like washing everything around the table, chairs, even the doorknobs, right? Before somebody touch it, get infected, let's clean it again and again, right? So this is desperately very common. This is very common into them. So they are desperately cleaning it again and again because they want to do it, avoid that triggering situation before it gets happened. Now, in the letter E on the screen, you will see repeatedly checking things like doors, switches, and lock. I think most of us, when before you go to bed, you always check your door, locks, windows. Well, if you do 1 or 2 times, normal, right? But let's say you're standing up again and again every 5 minutes or 10 minutes. You still want to check again and again, whole night. That is OCD, we called, right? Similarly, letter F, excessive hand washing, very common example. Excessive hand washing or excessive cleaning of anything, maybe utensil, could be as a part of the example of the OCD as well. And the next one is excessive attention on superstitious thought or luck. Sometimes there are some individuals like, I really want to try this lotto or lottery in my life because I think if I win, if I use this, I can win by tomorrow, right? Well, I would say if this is kind of behavior once a while, it's normal. But if it's excessively, you want to do this gambling, not the gambling word I would say, but it's something like you want to buy those tickets every day, could be a part of OCD as well, because you have a superstition in your brain that you're going to win. And then letter H, repeatedly performing a particular task for a certain number of times. You want to perform something, certain number of times because you think you want to do it. So same as example, let's say if I pull one of my presentation right now, let's say from my computer, and I'm keep checking the page number 3 of my presentation again and again, linking with my book, like did I put my this topic over there or not, right? I already check it twice, but I'm still checking again and again the same thing. Why I'm doing this could be a part of OCD, right? Similarly, the next example here, I can see avoid things. Give me 1 second. Yeah, avoid things, sorry, arranging things in a specific way, right? Arranging things in a specific way means you're putting maybe the clothes in a particular way, the way you like it. Or maybe it could be shoes, it could be any object, any furniture, any clothes, any books. It could be anything because you think you want to put it in that manner. Maybe you're such a person like yellow books comes first, blue books comes next, and then notebooks at the very end. And you really want to organize them in the same manner every time, right? So it could be OCD as well if it's a repetition behavior. Now, the second last we have example here is having intrusive, unwanted thoughts and the images of sexual and violent nature. Sometimes the people, they do wanna look more into something, unwanted pictures in their phone. Maybe they're thinking about it too much, or they just want to see those videos, those images in the cell phone. It could be sexual related, or it could be violent nature related, something violently also, maybe not a sexual, it's just the violent maybe also. But you really want to see that because you're thinking you just want to see that again and again, right? So this is something OCD could be. And the last common example is excessively engaging in rituals. This is very common question by most of my Asian nurses, I would say. They always tell me, ma'am, we love to do the prayer. Is that mean the OCD? Well, I would say if it's you're doing just as a not part of normal routine, then this is not the OCD. But if this is something you're doing very, very excessively, right? You don't want to eat, you don't want to meet your personal hygiene needs at that time, just prayer, 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 then it could be OCD, just so you know. Okay, so I hope everyone understand a little bit examples of OCD, how the OCD look like, right? Now, this was missing a little bit into the book, so I thought to talk about it. I know they talk in the form of related disorders and then some patterns and everything after that, but I think this is a way better notes in form of symptoms if you need it before you read the interventions with me now. Now, interventions, back to the same screen. We're gonna go back to the other side of presentation here as well, so we can change it. But the interventions, I'm gonna read it from the book, right? So from the book, if you see the interventions there, they are just merely talking about make sure your client needs are met, the basic needs. Because when they're busy in OCD, they forget to eat, they forget to sleep, they forget to take shower, everything. So make sure these things are met. So this is something being as a nurses, you need to look into. And then identify a situation that precipitates compulsive behavior, Encourage the patient to verbalize concerns and feeling. You try your best to figure out what could be the reason, how this behavior started again and again. If you can find some trigger, it's a great idea. And then the next one is be empathetic toward the client and aware of his or her need to perform the compulsive behavior, right? So this is something, try your best to understand their situation. You put yourself into that scenario, see how the patient, why the patient feel, how they feel about this situation again and again, right? And see how you can help them, to make it aware so they can leave that OCD as well. But the next three are very, very, very important nursing intervention, everyone. The first one important I want to say is do not interrupt the compulsive behavior when they're doing it. Okay. Very important. For example, if they're doing hand washing, don't just go inside and tell them, hey, stop doing hand washing, your time is done. No, not like that. You need to make a proper schedule for them and allow the time as per schedule. And for that rituals, you need to set limits basically. So for example, let's say I make a schedule for a client, maybe a written schedule, right? For the throughout the day, what they're going to do, So on a piece of paper, maybe I just write it down from 8 to 9. This is what you're going to do. This is from 9 to 10 you're going to do. Then you're going for 10 minutes hand washing. Then after that, you're going for recreation activity. Then you're going for lunch. Then again, 10 minutes hand washing. So I'll try to make a balance in between like this, right? And see if the patient like the idea about it as well, right? If they want to include more hand washing, okay, try to make a fair adjustment somewhere, right? But reduce the time limit slowly, not suddenly right away because that can aggravate the behavior further. So try your best to see if rather than doing 10 minutes, if they want to do 9 minutes maybe tomorrow, and then 8 minutes maybe after 1 week, right? And then 7 minutes maybe after 1 week, something like that you want to maybe introduce and see if your patient like that schedule. Because this way your client can be get busy into other things as well, not just doing the rituals all the time, what they wants to do as a part of OCD, right? So set some limits if you can. And apart from this, written contract they're talking about in the second last line. So this is what I meant with the written contract. Now, what does a written contract look like? Written contract is nothing. It's just like a technique, you can say. Some of the hospitals use, but not all of them. It's basically like a piece of paper. You write it down and discuss with the client along with the physician, and discuss with the client like, okay, we make the schedule, you agree with this, you're going to sign here at the bottom if you do agree with this, right? So when they do sign it, it's basically, connecting with your brain. When you sign something, it's connecting with the brain. Oh yeah, I signed the paperwork. I'll try my best to refrain myself from the hand washing, right? So this is how can be effective sometimes, but not maybe all the time. But you can try if your hospital has this technique and it's allow you to do it in that case. So it depends upon the hospital policies too. But this is the meaning of written contract, which gradually basically decrease the compulsive behavior frequency. Now, the last one they talk about recognize and reinforce the positive non-ritualistic behavior. Sometimes if they follow the schedule, you tell them like, okay, 5 minutes left for the hand washing, 4 minutes left, 2 minutes left, and okay, time's up. Now they're done, right? They listen you, try your best to reinforce them, with something positive. Okay, Mr. X, you did a great job today. Now, would you like to watch a TV? Because you like to watch TV for a few minutes. Okay, I'll give you TV remote for a few minutes, right? So what it could be any activity what the patient like. Maybe they have favorite food, favorite sweets, right? Something what they like about it. You try your best to reinforce positively. So next time they feel better to perform with you, right? So this is what we do in the OCD, and that's all about the OCD topic as well now. Now, any questions until here, everyone? What is OCD? Anything in OCD still you do not understand, or maybe you do understand this topic, not understand? Are you guys still here? I want to make sure you do understand this topic or not. So try your best to participate, everyone. Maybe if you want to use the chat box, that will be the great. So this way I know. Let me see here. Ma'am, in intervention, what's the question is this? Ma'am, in intervention, there is a word, jeopardize the safety of the client. Where does it say that? Oh yeah, number 3. Is that what you mean, Ahmed? Do not interrupt the compulsive behavior unless they jeopardize the safety of the client. Basically, if you try to interrupt the behavior, it could be a risk for client safety or maybe for someone else too. Maybe your client can become aggressive, right? So you really want to make sure you look at the safety of the patient in that area. This is the meaning of this line. I hope it makes sense. Any questions until here? Ahmed, do you understand this one? Or maybe other nurses, if you're still here, you're watching this video. Anyone has any question for me? Yeah, YouTube student says, yes, ma'am, we are still here. Perfect, thank you. Just want to make sure. Okay, good. Now, if this topic is clear for everyone, let's go to the next topic now, which is the bipolar disorder. Okay, so in today's class, we'll try our best to do as much as we can. But if something left over, I would say we can do in the next class as well, because I have 2 more lectures again coming up in mental health. And if needed, I can do another third after that as well. But we'll try our best to finish mental health by Monday. This is my goal. Okay. But if, let's say, for some reason not finished by Monday, we can do max by Tuesday also, because at the same time, we want to make sure we are not compromising our study, just wrapping up and make a speed or something, we want to make sure you guys do understand at the same time, right? So if it's taking time, that's okay, right? As long as you're studying and you know what you're studying and how, right? Now, moving on to the next topic quickly, which is we call bipolar disorder, right? Now, bipolar disorder, I can see if you go maybe skip one of the another page after, you will see actually in there mood disorders and depressive disorders. Yeah, mood disorders, right? In mood disorders, if you see a box, assessment of bipolar and related disorder, this is what I'm going to choose. This is a box. I believe it's a box number 694 for all of you, but make someone correct in the chat box if you do are using the 9th edition in there. I think it's 66.5 or what? Sama says 66.5. Okay. Yeah, in the 9th edition, I'm not quite sure what they look like, but if you want, I can pull the 9th edition at the same time as well, but it will take me some time. But yeah, it's a box which says with the heading assessment of bipolar, right? So if you refer this box with me, I can teach you using this box sign and symptoms, meaning of mania, meaning of depression, meaning of even bipolar also at the same time. And then we're going to look into later on the nursing intervention using something different. Okay. So looking into this box here, now, how do you read this information, right? You see, there's a lot of like symptoms in mania and depression. The first thing I want to say, don't just jump into and read it, okay? No, because practically not possible. Everybody gonna remember everything in there in the real test, right? So I would say the easiest method is, again, think as a clinical scenario in your brain for this one, right? Now, before you think the clinical scenario, what is bipolar meaning is, if you split the word, bi means two, right? So that means we are talking about 2 different conditions here in the bipolar disorder. Basically, in bipolar disorder, it does involve mania and it does involve depression, and they do not happen both at the same time. So there will be interval stage in between. So when someone is like in mania stage, After that, they go back to normal period, and then they go back to depression. And then someone who is in depression, then they go back to normal period, and then they go back to the mania. So it doesn't really happen at the same time, just so you know, right? Now, once you know the meaning of bipolar like this, that there's like a normal period in between, right? In these two, then you go and think one by one. So let's pick up maybe mania only first, okay? So what is the mania meaning look like? If your books already give you the meaning in there, then you go for that. But I don't really see much information like that into this book. I can only see they give you definition of bipolar disorders and everything. So after that, B, C, D, E letter, I'm not gonna read it. Not something important for the exam too, but yeah, but you can read if you want to, but as long as you understand the meaning, right? So now, once you know this information in there, then after that, as I said, mania. Mania is what? So to understand the mania, I want to think in the form of the as a clinical scenario. So imagine you have a patient in front of you, and that patient is actually running right now, like in the same area where you're working right now as a nurse today. So maybe from one side to the another side of the building, one room to the another room of the building, like in a one dining area, and then back to nursing station. Like it could be anywhere in the same way you posted today right now, imagination, right? So that patient who is actually like running or maybe walking faster right now, I'm going to take that personality today as a part of my clinical picture for the mania patient. Why? Because ask yourself, whoever is running like this, now you relate this book message with me. If you read in the book at the same time, it says the first point, become angry quickly. Ask yourself, who is running like this at this time? Do you think that patient can become angry quickly if you try to stop the person in between or you try to talk to the person in between? What do you think, everyone? What do you think? Do you think you will become angry at that? Do you think the patient can become angry at this time? Maybe I will make you guys unmute a little bit so you can participate with me. So just give me 1 second. Let me give you guys handle to your mics too, so you can participate with me at the same time. Give me 1 second. Hold on. Okay, you're allowed to unmute your mics now in case you want to come forward, and now you want to participate with me at the same time, right? So what do you think? Anyone, whoever wants to come forward with me, if your patient is running faster and you are trying to stopping the patient in between, interrupting the behavior, do you think your patient can become angry quickly? What do you
Yes,
think? No?
yes,
Yes, very good. And if I ask you second thing, delusional self-confidence, do you think they are too much confidence into themselves? Like I am the god, I am the queen, I'm the king on the floor. What do
yes.
you?
They
Yes.
have illusions of grandiosity.
Very good, right? And then constantly pushing the limits, manipulating, finding the fault, right? So, do you think this person who is walking and running faster on the floor, maybe pushing a lot of limits around, like they want to do what they want to do, maybe they will manipulate you or someone else on the floor, because this is their behavior, and they're not gonna find problem in themselves, maybe somebody else on the floor. So do you think yes or no
Yes,
with this one
ma'am.
too?
This happens mainly with the mania client. Even I seen practically in
Mm-hmm.
psychiatric ward.
Yeah, very
Yes.
good. Yeah, see, so if you guys have previous experience, maybe you have the previous clinical picture in your brain, you can do that, or make imagination right now in the brain, everyone, so you can find out the answer, right? So similarly, you ask yourself, euphoria, that means too much happiness, ha ha ha, too much happiness with intense feeling of well-being. I'm okay, I'm fine, and they're talking usually louder when they're laughing louder, euphoric mode. This is, do you think is common? Yes or no?
Yes, ma'am.
Yes, ma'am.
Very good. And then after that, it says demonstrate little or no inhibition. What does it mean? So sometimes, you try to ask them to come in here and participate with you. It could be any activity, maybe even just sit and maybe take some food, right? Or maybe drawing or playing a game. So most of the time, they don't want to sit. They don't want to participate. If they sit only a little bit, only for some seconds, and they're not interested, they will move on to the next side, right? So ask yourself, applied, not applied, yes, no, good idea, bad idea in this diagnosis. This is how you should ask yourself question. Now, why I'm asking you guys in this format? Because as I said, your this list is not going to be exact copy paste in the test, right? So if you know the meanings and they give you a similar word in there around, then it's easy for you to find out the answer in the questions, right? So that's why you really need to guys know the meanings. Like if this is something really applicable, if yes and why, right? Now,
Even even
mhm,
ma'am, this Mania clients cannot be. I heard that they cannot be involved in group therapy because they
mhm.
may be disturbed. They're not giving another chance to anyone to
Yeah.
speak.
Yeah, it's coming up in the next, like in few more further points. We will read about the same information, the one you just mentioned, Manpreet. So maybe I'll look into that, your example back again in few seconds. So when it says distracted by environmental stimuli, yeah, they can easily get distracted, right? So if something comes in front of them, they will just go to the other side of the building because they don't know what they were doing before, right? And then extroverted personality. So rather than keeping more in themselves, they will just talk with everyone on the floor and share everything, whatever they want to share, right? I hope everyone learning so far, even the YouTube students, you can participate in the chat box with me. So I know that you're still watching this and you're learning it around as well. And then it says flight of ideas. They have lots of ideas at the same time. So right now they're talking on one topic. So without finishing that topic, they will move on to the another topic, right? And again, they're not going to finish that topic. They will talk about something else now. So for example, let's say if I'm the mania patient, I would be like, nurse, I'm going to room number 2, 3. Oh, my family comes today. Oh, I think the supper time is in evening today. Oh, TV needs to be watched, right? So did you guys notice? Like I just mix up 3, 4, 5 different things together because it's too much on my brain, maybe right now as a mania patient in there, right? So this is how you think about the examples at the same time. Even I know the NCLEX not ask you example, but you should know at least clarify the meanings of these words in yourself. Grandiose delusion, someone already addressed this before, so this is good. It's already been done. Like grandiose, G for God. You think you are the king on the floor, right? And then persecutory delusion. Persecutory means you're kind of suspicious to the next person. Oh, are you here to kill me? So this is how they think about the next person all the time. Very common, I would say, in mania patient. And then majority of the time when you see their body movements, you will see they're very on the higher side. Their expression looks pretty different. So they will be having unstable affect all the time. And they will not stop for you to eat. So they hardly eat something, decrease appetite, right? And they don't eat much, they don't sleep much. So definitely nursing intervention, we need to look around these things for sure. And then you will notice they have unlimited energy all the time. That's why they are just keep going, going, going. And inappropriate effect at the same time as well. So again, this is the facial expression, the body language, which is not acceptable to the next person. So they're gonna make a weird expression, which is unacceptable by the next person to receive. Could be maybe sexual related as well, right? Now, let's see here the next one. The next one, yeah, somebody says hyperactive. Yeah, this could be hyperactive too. Yeah. And then dress that is inappropriately bizarre, loud, colorful. So if it's especially a woman, the woman usually wear a lot of jewelry, a lot of makeup, right? If it's a man, I would say usually loud colors, or maybe sometimes, during summertime, the person will wear the winter clothing, and during winter time, the person will wear the summer clothing. Could be opposite, right? And then makeup, we already talk about it. And then initiation of activity, we already talk about it, like how much they want to participate as well. And the next one, easily, they have restless, pressure speech, clanging speech. What does it mean? What is the meaning of clanging speech? You know, when someone talks too fast, sometimes you don't understand some words in there because they speak too fast, because they're talking with too much pressure with the tongue in there. So that word sometimes which you could not understand because they're putting so much pressure on their speech right now, that one we call at the same time clanging speech, right? And this is very common in your mania patient because they're hyperactive all the time, right? And then they're always being restless, right? Sexually promiscuous. So they do have more libido for the sexual activity, right? And urgent motor activity, which means they don't stop at one point. You know, even if they try to sit in one position, they will stand up right away in there. So this is we call how the overall mania patient look like to someone, you know. Now, if any other sign and symptom come in your exam, if you know overall meaning of this mania patient clinical picture, how does it look like, you can easily correlate it there, believe me, right? Now, the next one I want to talk about from your book, the interventions for mania, everyone, because we're still talking about the mania. Then we will come back and compare the depression person easily. So, interventions for mania is nothing. It's just like you remove the sharp objects first because you know they can become aggressive sometimes. And assess the client closely for fatigue because they all the time walk too fast, run too fast, and they hardly eat enough. And provide frequent rest period and monitor the client's sleep pattern. Use comfort measure to promote the sleep as well, right? This is very important. You remind them, you know, or maybe make a schedule in your nursing station, like a document sheet, you know, what time the patient go to bed, what time they wake up, for how long did they take a nap. It's easy for tracking purposes, right? And then provide a private room if possible because they're usually hyperactive. And you want to make sure you want to give them calm and quiet environment as well. And encourage the client to ventilate the feelings because sometimes they're too much loading in their brain. Maybe talk to them, see if they want to talk to you and share something about what's going on in their brain right now, especially if they are in acute stage. A little bit after settling down in the acute stage, when they get calmed down, maybe just talk to them if they want to vent it out to you. Use calm, slow interactions, right? So slowly talk to them, being as a nurse. Don't talk too fast in front of them, loud voice and everything. Don't say them like, hey, you need to listen me, I'm your nurse. No, because they will fight back with you, right? So those things are definitely a non-therapeutic way and unprofessional. We don't talk like in that way. So try your best, make your tone a little bit calm and slow talk, not too fast, so the patient can understand and they can talk to you. And then help the client to focus on one topic during the conversation. So basically, uh, don't talk everything together with the patient. Don't tell them it's your bathing time, and then also I'm going to take you for lunch outside today. Then we will do this activity together. It's too much already in their brain. So one topic at a time, you need to deal with it as a nurse. And then ignore or distract the client from grandiose thinking, present reality. Very important, everyone, very important. So if the patient tells you, let's say if you have a question MCQ, the patient is like, I'm the king on the floor, I'm the queen on the floor. How would you respond as a nurse in that case? Always try to find that answer where you're presenting reality, not like, okay, you feel that, okay, this is good, this is normal. No, don't say that. Instead of that, you should pick that answer which says, this is only you feel, Mr. X, because it's a part of your diagnosis. But being as a nurse, I don't see that. Okay. So basically, you need to give them reality. This is only because of their diagnosis. That's why they're looking into. Okay. And then after that, it says, do not argue with the patient. Very important because you don't want to make them to become aggressive. and you don't want to get to be hurt by them as well. And then limit the group activities and assess the client tolerance level. Solitary activities may be necessary to high calorie finger foods, fluids, you really want to give it because they hardly eat something, so try your best to give them such a food. I would say high protein diet, high carbs. It's not written here, you can write it down as well. And they hardly drink something. Even in the drink, see if you want to give them high protein drink somehow, right? So something like a shake. And in the food, finger foods, like for example, you want to give maybe something handy which they can carry and they can just walk, maybe like a fries combination with the you can say chicken sandwich if the patient like a chicken, maybe like something in protein at the same time, right? So something handy which they can, maybe a toast, something they can carry and they can just walk away. And then supervise the client choice of clothing also. This is very important because otherwise they will overly dressed sometimes. And then reduce environmental stimuli if possible, set some limits on their behavior, and provide physical activities and outlets for tension. This is just nothing. This is basically they're trying to telling you set some limits on their behavior, but instead of that, give them more physical activities to do if possible, right? And then when you give them some games, don't give too much competitive games because they're already so much loaded, right? So try your best to give them simple games, which is easy for them to achieve something in there. Because if they do not achieve the good results, they will get more frustrated in that case. So you're basically making things further worst. So rather than that, something achievable games, you want to give it to them. And then provide gross motor activities like such as walking, structure activities or one-to-one activities with the nurse, simple and direct explanation, routine procedure. Yeah, simple talk, try to explain them who you are, why you are inside the room, what procedure you want to do it. So simple things. And supervise for sure when they're taking the medication as well. Very important, right? So that's all about, I think, in Mania. I think Mania is pretty simple and easy once you have this clinical picture in your brain. Now, if anyone has any doubt, any questions so far, feel free to use your chat box again for me so I can address the question for you again. And if someone has any doubt, yeah, let me know. And if no doubt, I'm just going to move on in the meantime to the next topic, which is the mania. I'm just going to see your chat box if there is any doubt or everyone understand this topic or not. Okay, let's see here. Any messages? Understood topic, no understood topic. Okay, any doubt, any questions? Clear? Okay, perfect. Just want to make sure. Okay, so moving on to the next one, which is the depression, right? So if I compare the depression now, depression is like what? Totally opposite, right? So again, have a clinical picture in your mind, someone who actually totally opposite of mania. So this person, a clinical picture as a part of example, imagine this person is just sitting inside the room all the day, doesn't want to go outside anywhere, no participation, nothing, doesn't want to drink or eat enough as well. So this is overall, what is the depression usually look like as a clinical picture. Now you have that set up in your brain, the clinical picture, the one I give it to you. Now you see in the book back to the same table, the one you have in the depression, right? So if you see in the depression says increased or decreased appetite. Okay, so remember when someone has a depression stage, right? It depends. Early depression can increase the appetite also, and the late stage of depression can decrease the appetite also. It depends on what stage of the depression is, right? So, for example, let's say if someone just has a recent breakup relationship, right? So breakup relationship recently, that makes a person to go into more guilt, aggressive, like why me, why this person break this relationship with me. So at that stage, eating more is usually common. But in the when you go little bit like after the few months or years, it depends. When someone go into the severe depression, the late stage of depression, at that time, eating hard, like the person really hardly eats, right? So less eating is very common, I would say, in that stage. So that's why in this book, it's written like both increased or decreased, just so you know. And then decrease in activities of daily living. So person doesn't want to participate with anyone too. Decrease emotion, decrease physical activity, right? Easily tired, right? Because not eating enough, you're just sitting there. You're not even doing any activity with your muscles, right? And they can't even express sometimes their emotions, and they don't want to participate anything in there. So that's why it's everything decrease in there. And inability to make decision as well, because they are just being in their own guilt what they have at that time. So they don't want to have good concentration on the other skills, so their concentration power is getting reduced. And then internalizing hostility, this is mainly is basically, when someone create, like, you can say, an imagination bubble around them, and they don't want to come out of it. So for example, if I'm the depression person right now, and I'm just sitting in one of my room, maybe one of the couch right now on the sofa, and I don't want to stand up from there, right? Because I just want to hide myself in there, more comfy, feel only in that space. And I don't want to come out and talk with anyone, not even want to stand up from there, right? So this is something you create around yourself, being as a patient. This is we call internalizing hostility, making yourself in there. And then introverted personality. So now these patients, they usually do not talk, just keep everything in themselves, right? And I think this is why that is why we always read in the news or maybe in different nursing articles or medical articles or news around the world. If you guys know that, like they always say is like, it's good to socialize and talk to someone, make some friends. Why? Because if you don't do that, the person can go into depression with a lot of stress and anxiety, and they just feel guilt into themselves, right? And one day you just don't want to feel like to talk about it with anyone, right? So it's better to come forward, being socialized, more talk could be a good idea to reduce the depression. And then it says in your box back again, the next symptom is social isolation and withdrawn from the groups. These patients, they usually don't like to participate. Even if you take them into 1-to-1 person group, very hard, right? But you still have to try as a nurse in there if you can. Lack of energy, any initiative is always lack. Self-confidence is lack. Self-esteem is bad. And even they don't even have a sexual interest as well. Even their psychomotor retardation, the brain capacities and everything is going to be reduced. And these clients are at more risk for suicidal thinking. Very important. Underline. Question can come most of the time on this topic too. So suicidal thinking, remember, is more common in depression, especially I would say uh, when someone is coming out from the depression. There's a changes in the mood, I would say, or the energy level, and then they're coming out from the depression. Then suicidal thinking is usually more common rather than in mania. Why? Because when someone in depression at the stage of the actual depression, they feel like life is no more good for me. So they just don't want to live it because they feel like I have no purpose, right? For some reason, maybe something happened in their life, or maybe they lost somebody in their life too, any tragedy. But after that, when they come out from the depression stage, now they have more energy to do it, to make it happen. The one they were thinking about it to do it before. So it's less likely chance during depression they will do suicide. But I know as per the textbooks, we still always consider depression still. But practically, when they come out from the depression, this right outside, when you see someone, um, you go every day on the shift, they don't smile at all because they are in depressed, right? But one day this person is laughing, smiling a lot. Suddenly, why? You should be alert. You never know they are thinking about suicidal today, right? So this is something I want to highlight it in there, right? Very easily. And then once you know these way the sign and symptom, this is how you read the sign and symptom as a student. Now you need to know the interventions for the depressions as well, right? So now in your book, I can see, let's see here, where is the interventions for the depressions? They actually kind of divided everything in here in your book, like mild, moderate kind of thing in there. NCLEX usually not ask in this way, but yeah, if you look into the box which is given, I don't know what's the box number again in your ninth edition. If someone want to put in the comment section, that will be great. It says intervention for depressed clients. There's a box, there is a table. So let's see here. Maybe somebody put in the comment section for me. Yeah, 66.6. Thank you so much, Manpreet. And then in that box, this is the overall nursing intervention, look like for your depression, what you supposed to do. So if you see the first thing, what you can do as a nurse for something related to the harm, right? So you can do maybe check for suicidal ideation, homicidal person does have a thinking capacity to kill themselves. And then you can think about the safety for your patient. You can look something around in the environment to remove those harmful objects. And in this case, do not leave your client, your patient for a long period of time. Better to do one-on-one nursing intervention. It's a great idea. Have somebody from your shift and make it next to the person in there, right? Because if they're already thinking about something, you need to do something right away. And then they also talk about no suicidal contract. Again, it's the same method contract, the one I told you before, the OCD patients, right? Excuse me. So it's the same method, like you have a form in front of you, right? And then you discuss with the patient, physician also sit there in that meeting together. And then you guys talk with the patient like, okay, this is what you're gonna agree with us now that you're not gonna commit suicide back again. Again, why the patient required to sign these type of forms and why some of the hospitals they do allow it, because sometimes it depends upon the patient also, but sometimes the patient they get angry because they're thinking like, oh, I signed one paperwork, I'm not going to commit suicide because I signed for it, right? Some people they like to follow the honesty in their life. So maybe you never know, your patient will not commit suicide back again. So again, these forms are very rare in very some of the hospitals, but not everywhere. But if it's there, better to get it done if it's allowed. Now, related to activities, what you can do as a nurses in there, you can do some gentle encouragement to participate in activities of daily living. Gentle, okay? So don't force them. Don't tell the person you need to participate. No, instead of that, encourage the patient to participate. That's a better idea. And do not push them, right, to make those decisions, especially complex choices. It's a bad idea because they're not ready for it to absorb that information. And then provide achievable activities in which the client can achieve success. So do those things in which they can feel more success. They feel something worth it out of it in their life, right? So don't put that activity in front of them which is hard and they feel like, no, I lose the game, see, I'm a bad person in my life. No, don't do that. So instead of that, give something simple, I would say, not a complicated games in front of them. But yeah, those activities which they can easy mastery as well to increase those self-esteem and make those guilt feelings go away, right? And then engage the client in gross motor activities, which we call walking. As all of you know, I think most of you know that walking is a good idea to decrease depression for anyone because it reduces stress, because it provides more oxygen towards your brain. You feel better a little bit, right? And then eventually bring the client into small groups. So slowly, have your patient come out of from the room if possible, walk in there, even a few steps. And then try your best to see if they want to maybe talk to someone on the floor, participate with a one person only. And then if they feel one person and small group, then you put them into the large group. But usually it's difficult to go into the large group right away. So take your time. Don't push your client in this case. Okay. And then after that, you want to think about some nursing interventions around nutrition related also. So around nutrition, make sure you keep checking their intake and outputs, like weight and everything, because they hardly eat something, especially in severe depression. So try your best to give them small amount of food, high calorie, high protein, and something fluids if possible. So don't put whole plate in front of them. One little food at a time. So let's say one time you took small amount of yogurt, high protein yogurt, maybe Greek yogurt, right? And then second time maybe small amount of fruit, third time maybe small amount of fluid, like slowly introduce something in there. And then stay with the client during meals. Good idea. So they feel like somebody's there to look after me, this person is taking care for me, to listen me as well. Oh, this person, this nurse actually cares a lot that I make sure I eat something today, right? So try your best to stay if you can during your shift. And then hygiene related, you can definitely keep monitoring it, because usually when their depression get worst, you will see their basic needs are usually not met at that time, right? So you want to make sure it's going to be met in those cases. So try your best to go and participate as a nurses in there, and also assist with the daily living activities as well, like grooming, changing clothing, walking. It could be anything, right? Toiletings. And then sleeping pattern. Regarding sleeping pattern, make sure you keep monitoring it. So, like, make a track sheet, documentation, and then decrease something stimuli at the bedside, at the bedtime, sorry, bedtime if possible, and spend time with the client before bedtime as well, if possible, as I said. And then regarding the thought process, what you can do is remind the patient time when he or she feeling was better in their life and more successful. So for example, if your patient was, let's say, was a farmer before, maybe talk about something farming with them. So that makes the person, to think something positive, what happened in their life before, right? And then spend time with the client to convey the client worth and value. Maybe see if you want to spend some time with them during your shift, because that makes them feel, as I said, oh, this nurse is caring for me. She actually cares. I should live in my life, right? And then encourage the client to discuss those losses, some changes in their life situation too, if they can, because sometimes they don't want to talk, but if they can. And let me tell you, this is usually happen when you actually become stay silent sometimes. So you might need to use your therapeutic communication skills silence in here, because most of the time they don't respond and you need to wait for the response, even if it's a single word, right? And then encourage the client to express sadness or angerness and allow the adequate time for verbal responses too. Yeah, try your best. See whatever they want to express to you. Maybe something, a bad behavior, good behavior, anger, sad, crying, happiness, whatever comes to their mind. See if they want to talk to you regarding something. And respond to anger therapeutically, which means if in case they become aggressive, you need to make sure you don't raise your voice as a nurse further. Don't argue at that time. You need to make sure you make a distance first and maintain silence, calm approach at that time. See what makes a patient to become like that, right? And it depends upon situation. If they become too much aggressive, maybe you need to call for help around you for the safer side, but do not leave the patient for extended period. You still need to make sure you can still look at them, something still visible in their room, like you can still stand maybe next to the door if they become too much aggressive. But yeah, if the person is just mildly aggressive, you can stay around them still, if it still makes you feel it's safe to do it, right? So that's all about the bipolar disorder, mania, depression. Any questions until here, anyone, for me? This is how you should read it. See, now I hope everyone is learning how to read the sounders, because I know a lot of students are like, how to read the sounders. This is how you should read the sounder. Make something interest out of it. like how to read the Saunders, not just cramming it. Okay. Any questions until here? You guys understood? No understood? Okay, I'm just waiting for responses maybe in the chat box because I want to make sure you do understand something. Or maybe what I'll do is maybe we can wrap up until here today if you like. And the rest of the topics, schizo, personality, delirium, dementia, Alzheimer's, and as much as we can do more after this. Maybe 2, 3 more diagnoses we can easily do in the next class also, right after this. And then probably 2 or 3 more max lectures we needed to cover even the medications also at the same time. And hopefully by Monday, Tuesday, we can done with the mental health. This is, I think we can do this. So now you guys are allowed to unmute yourself as well. If you want to use the mic, you have any question for me, you understand this class, do not understand, still understand how to read the Saunders, or do not understand how to read the Saunders, just let me know, please. Thank you.
No, ma'am, everything is fine. Your
Mhm.
method is really very good. So now we understood everything.
Okay,
Yeah.
perfect. Any other questions so far, anyone?
Thanks, ma'am. It's very effective. We learn a
Mhm.
lot of things. Thank
But
you.
do you guys really understand how to read the Saunders? This is my main concern still for all of
Yes,
you.
yes, ma'am.
Mhm. Okay, I want to make sure you guys know that. Okay, anybody else? Okay, I can see some messages. Let's see here. YouTube students, I don't see more messages in there. You guys understood? Still, I can't. Okay, I think you joined the class little bit late today, Rija Khan. Maybe you want to go back to my video a little bit after I posted there today. It will be there right after on the YouTube. I'll send you guys the link also in the group also. But if you rewind my whole video, you will see in there. But if you still do not understand, I highly request to send me a message on WhatsApp so I can help you still in there. Okay. And Raki says, ma'am, negative, positive symptoms. Yes, Raki, we need to read that. When we will talk about schizophrenia topic next time, yes, we need to talk about that too. Yeah.
Excuse me, ma'am, I have one question.
It's a little bit okay topic. Still need to be learned. Yeah, for this test. We need to know. Yeah. Mm-hmm. And then let's see some other questions here on the screen. What is the most important topic in this? So this is the topic which I highlighted already on the screen in this chapter. These are the most important topics in this chapter. But as I said in the beginning of the video, if you can read more out of it, it's a good idea, right? If you have a lot of time to write on this test, right? But those students who are writing within a month, maybe you don't have enough time to read everything in there. So that's understandable. So they can only read the most important ones, right? So Pooja says she understood. Manpit says all good. Brenda says good. Thank you. Malik says good. Sarah says good. Okay. Any other student? Understood, you do not understood. Even if you do not understood, come forward. Let me know what is your doubt look like so I can help you. Okay. No questions so far? Okay, perfect. See, you guys master 1, 2, 3, 4 topics today in the mental health. And I'll try my best to cover the more in the next class. But as I said, I don't want to being in rush at the same time, just deliver and talk and you don't understand, right? So that is not effective at the same time. So we'll try our best to cover as much as we can in the next session. But the next session now, everyone, before you leave, it will be on Sunday. Not tomorrow, it will be on Sunday. What time is going to be on Sunday? I'll post it soon within next few hours. Yeah, so stay connected with me everywhere and let me know if you have any other questions. Always text me around if you have more questions in there. But thanks for joining today. I appreciate it. Thank you, everyone. Bye for now.
Thank you so much, ma'am.
Yeah, no worries. Thanks, everyone.
Thank you so much. Have a good night.
Yeah, thank you. Yeah, you too, guys. Have a great day.
Thank you so much.
Thank you, ma'am. Allah Hafiz.